Okay, so I'm going to talk to you about the Explorer that Ms. Grooms lectured on yesterday, and this is just to reinforce some of the things that she talked to you about in lecture. I'm gonna pull the cheeks back there so you can see there. First thing with the Explorer, this is the 11-12 Explorer. On Friday's class, I talked to you about the terminal shank and the functional shank, and I talked about how important it was to recognize the difference between the functional shank and the terminal shank. So with your 11-12 Explorer, select the correct working end, you want to use your terminal shank. And the book talked about your terminal shank being parallel to the proximal surface of the tooth, and it talks about the functional shank being up and over. So this is your terminal shank, as I shared with you on Friday, and this is your functional shank. So if your terminal shank is parallel to the posterior tooth, normally we choose the premolar. So if your terminal shank is parallel to the proximal surface of the premolar, your functional shank will be up and over. So this will be your correct working end, and you can flip it, and you will see. And excuse me, let me go back to the correct working end. If you come here, your handle is going to be coming out of the patient's mouth. Okay, so the handle is coming out parallel. The terminal shank is parallel. You see how I'm also up on my fulcrum, which is my parallel. My terminal shank is parallel, and that's the first thing you want to do is you want to establish a fulcrum. Because if you don't establish a fulcrum, you can the terminal shank can just be in there like that. It can be either way. Okay, so you want to first establish your fulcrum, and this is where you have to talk about me, my patient, my equipment, and all that we talked about on Friday, and then your finger rest or your fulcrum. So if you establish your fulcrum, being up on your fulcrum, this is your terminal shank and it's parallel. Okay, I'm gonna try the incorrect working end and show you the difference here. Of course, yes, I can make this is my terminal shank, and this is my functional shank. I can make it parallel, but if I do, the handle is going down the patient's throat. Okay, so that will let me know that is not the correct working end. And then you see also my position. Look at my arm and all that. It's just all out of whack. Okay, so you're gonna go back to select the correct working end, fulcrum, and make sure you remember your grasp that we talked about. Soft C, thumb and index finger across from each other, middle fingers on the shank, fulcrum is extended, and pinky finger just kind of hanging out there. So terminal shank here. We start at the distal line angle, and Ms. Grooms talked to you the other day about the different motions. We have a finger motion, and then we have a wrist rocking motion. We use the wrist rocking motion. We never use the finger because you can start having problems with your finger. The wrist rocking motion is where your wrist is rocking like this. So actually, she used a term yesterday about rocking off of your fulcrum. So this is what she meant when she talked about rocking off your fulcrum. Your fulcrum is extended there. You place it on the tooth, and you use your stroke up and down. And this is when you're going on the distal surface of the tooth. You come out. You start back at the distal line angle, and this is where you come across with using oblique strokes. They're kind of diagonal strokes. And then you come mesial, you go into the mesial surface of the tooth. Also, you want to make sure that your tip third, and we talked about that too. I talked about the tip of the instrument. Make sure your tip third is always adapted to the tooth surface. So this is your tip third. So hopefully you can see there. So I'm just going to go back over that. Start at the premolar. I'm going to start just hit this tooth. Let's go back to the molar so you can kind of get a good feel of what I'm doing. Distal line angle. And notice my wrist is rocking. Notice my tip third is adapted. I'm going to go all the way in a proximal. Okay, so you see I'm making my strokes all the way in a proximal. I'm not just getting here and scooping out like this. I'm making my wrist rocking motions all the way in a proximal. I'm going to come out, go back to the distal line angle. Now my strokes are going to be oblique. I'm still using my wrist rocking motion. I'm still on my fulcrum. My fulcrum is still up, extended. Once I get to the mesial, my strokes are going to be vertical again, and making sure my tip third is still adapted. Go back to the distal line angle, premolar, rocking off my fulcrum, going all the way in a proximal. Come back to the distal line angle, going all the way here, going in a proximal, keeping my terminal shank as parallel as possible. Distal line angle. Now that I'm on this premolar, I'm kind of fulcrum on the incisal of the anterior, because you know we talked about fulcrum being 1 to 4 teeth away, and we talked about the length of the fingers. So because I have shorter fingers, I'm going to have to be a little bit closer to the tooth. So distal line angle, and I want you to stay above. You can go sub underneath the gums, but I want you to kind of stay right at the gum line so we can see where how your tip is adapted. And all the way in approximate. Okay, so that's how you do the posterior. You do the same apply for the maxillary. You choose your correct working end, same way. Terminal shank parallel. So this is my terminal shank right here. So we use the premolar. It's kind of hard to keep this mouth open. So I'm going to use the premolar. And my terminal shank is parallel. And so my handle is coming out of the patient's mouth. Once again, yes, I can make it parallel with the wrong end. So if you think about it, look at my wrist is all bent here. My handle is going back into the patient's throat. And this is not how we practice, not good ergonomics, okay? So we want to think about our ergonomics. Interproximal, you gotta have my fulcrum. Like I said, you gotta have a fulcrum. You can't just get in there like this, because you can make it interproximal if you don't have a fulcrum, even if it's the wrong end. If I don't have a fulcrum, yeah, I can make it parallel and it's not as bad. But once I get my fulcrum, that's parallel. And if I have my fulcrum, I try to make it interproximal the wrong way. Even with the fulcrum, I have to be all concocted like this. So always establish your fulcrum first. So maxillary, I'm gonna start at the distal line angle. And my hands are kind of all looking kind of a little crazy because I'm trying to hold this up. Distal line angle. And you see my wrist, I'm still using my wrist motion. And come distal line angle, and then come mesial. Distal line angle, going distal. And see, once again, we talked about it earlier on. My wrist is up because I'm on the maxillary. Distal line angle, coming all the way in proximal to the mesial. Okay, now that's for the posterior, and the same applies to the posterior. Terminal shank is always parallel on the posterior teeth. Okay, now when I go to the anterior teeth, as Ms. Williams mentioned to you yesterday, for the anterior teeth, you're going to make sure your terminal shank here and the working end of your instrument is always pointing towards the tooth. I'm going to give him a little gingivectomy here. This is in my way. So you see how it's pointing towards the tooth? Okay, so my working end, and this, you remember Cindy talked about the get ready zone. So I'm just going to start at these anterior teeth here to kind of give you. So get ready zone. Once and my palm is up, I'm fulcruming on the incisal edge. Get ready zone. I'm going to kind of slide up in a proximal. To the gum line. And I'm going to go in a proximal. So now I'm going surfaces away. So let's go ahead and do the clock position. So I'm 11 to 1. I'll start at the, I'm going to go ahead and start at this lateral here. Normally we start at the canine, but so you can see, I'm going to start at the lateral. God, I can't hold that down. Can you hold that down for me? Thank you. So I always start use the tip third. I'm going to start at the get ready zone. And when we're on the anterior teeth, instead of your terminal shank being on parallel, your terminal shank, once you get an approximate, your terminal shank is across the tooth, as she talked to you about yesterday. Get ready zone, tip third, sit up to the gum line. Go all the way down in the proximal. Once again, you don't want to get in there and then just slide down like this. You don't want to slide down and you want to work your all the way in a proximal, because it's going to be calculus deposit down in there. And you might want to feel, you want to make sure you feel. Terminal shank going across. So now I'm on surfaces away. And we talked about on also keeping your wrist. So now I'm going to go on around to maybe like 11:30ish, somewhere here, to keep my wrist straight. As I get to this one, my wrist is patient a little high, so, and then I come around to 12 o'clock. So this is when we can use this 11 to 1 to make sure our wrist is parallel. All about ergonomics. And I always want to start the get ready zone. Because if you go in and just go straight to the mouth, you can slip or whatever. So you establish your tip third here, establish your fulcrum, look at everything together, and then slither in to the get ready zone. And slither into the gum line. And then when I do surfaces towards, I'm gonna come around to 8 to 9. Turn my patient's head towards me a little bit. Same thing, like she said, your terminal shank is going towards the tooth. Tip third, and come in approximately like this. Terminal shank going across that tooth. Terminal shank going across the tooth. Now, if it was the wrong end, it would be, if I was coming surfaces way, surfaces towards me, it'd be the wrong end. You see how this is coming, it'd be going up into the gingiva like that. If I was coming towards me, okay? So you don't want that. And you don't want this terminal shank is coming up off the tooth too. Yesterday, like she mentioned, your terminal shank should be pointing towards the tooth, okay? So it's down like that, and then your tip third is down. But this will be the wrong end. This is coming up off the tooth, and the tip third will be sticking into the gums, okay? So that is your anterior. And for the mandibular, I think Ms. Brooks actually. Ms. Brooks. So for the mandibular, if you're going to do surfaces towards me, same 8 to 9. My terminal shank is going towards the tooth. Starting here again at the get ready zone. Get ready zone. Come all the way in approximate. See how I'm kind of up on my fulcrum? My fulcrum is not lazy like this. I'm standing up on my fulcrum. Get ready zone, tip third. I'm using my wrist rocking motion. It's kind of like opening a doorknob. That's your wrist rocking motion. So if any of you having a problem with the wrist rocking motion, like Ms. Room told you yesterday, just sit on your fulcrum and just rock like this. Just like go up to the doorknob and rock like that. If you open the doorknob. So here, get ready zone, coming all the way in approximate. Get ready zone, all the way in approximate. Get ready zone, all the way in approximate. And then the clock position, you go on surfaces away. Here you have your 11 to 1 zone again, okay? So going away, get ready zone, coming in approximal. Terminal shank coming across that tooth when you get on the proximal, okay? So this is just a little quick reinforcement of what she went over with you yesterday. Make sure you use this to practice for your assessment on Friday. If you have any questions, you can email me through Canvas. Thank you.